ladies and gentlemen. Welcome back to another fabulous episode of the Healthcare Trailblazers podcast. Today, I am very excited. After months of getting this in the works, I'm very excited to have Eric Weaver here on the podcast. Eric is an extremely strong voice with an extremely robust podcast of his own. So, Eric, you're probably used to be being the one doing the intros. But today, I get to welcome you. Thank you so much for joining us today. It's great to see you.
Mendel, it is so great to be here. I'm such a fan of yours. You have such great energy, and your passion for this type of work and healthcare transformation. It keeps me inspired. So it's a pleasure to be with you today.
Making me blush. You're too kind. Well, I appreciate you. Let's kind of just jump into where did you grow up and why did you get involved in healthcare?
I grew up in Central Texas, kind of modest upbringing, always gravitated towards healthcare. I think it's one of those things where, if you're going to pick a profession or an industry to be a part of that's purely, or at least, not knowing any better, thinking it's entirely altruistic, which I kind of grew up thinking healthcare is a right, not a privilege, want to help my fellow human being. What a great place to be a part of it, of supporting others. I started off in the clinical side, believe it or not, as a clinical laboratory scientist or medical technologist. So I worked in the kind of the hospital laboratory, doing, blood work and urinalysis and microbiology, blood banking, things like that. And I'm just too extroverted, to be, in the laboratory.
Yeah.
But I had a great experience just working with other providers and got into the business of healthcare about 20 years ago. Upon getting a kind of a formal degree in healthcare administration, and just really kind of hit the ground running. I've always had an alliance to physicians and affinity towards the work that they do, and spent the first 10 years of my career managing medical practices. And it was a really formative time for me because early on in my career, I kind of saw some maybe a little bit of the dark underbelly of healthcare in terms of fee-for-service excess. And, it just kind of put a lens on, the way I viewed the system. And I was at a point where I was, getting kind of disenchanted with healthcare, chasing volume and, cranking RVUs and having conversations that didn't always have the lens that I had, was through that, purpose and altruism. And, all the providers I worked with, I've worked with some fantastic ones, but you always have to balance the kind of the missionary and the mercenary perspective when you commingle the business and the altruism of healthcare. This is around the time the Medicare Shared Savings Program was starting, about 2014. This was kind of a moment for me to kind of try something different. I had actually just gotten back from a trip to Cuba, where I was part of a kind of a healthcare research delegation with physicians and other administrators. And I saw, high touch primary care, community-based interventions, strong relationship-based care models, and it inspired me. And I took on a role in starting an ACO of my own. So we built out an accountable care organization in West Texas, a very rural, underserved population. And we just kind of did all the things right, won the Medicare Shared Savings Lottery and, looked to scale that. I parlayed that into working with a management services organization, built out several of these accountable care organizations in the state of Texas. But that's a little bit about my story. Once I got into value-based care, I'm just a lifelong learner, very passionate. I'm sure that comes through, and and just learning a little bit about my background. And I got a doctorate in healthcare administration, and I was always interested in kind of that nexus between learning and value-based care transformation. There's workforce and that element of it, but there's also, I think, the storytelling of value-based care, which I think is something, Mendel, that you and I have in common. And, I think about that parable. I think it's a Navajo proverb, tell me the facts and I'll learn, tell me the truth and I'll believe, but tell me a story it'll live in my heart forever. And that's the way I think about value-based care. This is not unlike a social movement that we've seen in our country, similar to civil rights or even gay marriage. This is something that I think imperatively it has a moral and an economic compass to it in terms of the imperative to drive more cost efficient, equitable outcomes for populations served. I think especially coming out of the pandemic, we're at a really important inflection point. So it's always great to through the work that I do, provide meaningful content and inspiration, highlight exemplars, and then in the work that I'm doing now with Lumeris, which is a value-based care enablement company that provides a lot of the technology and advanced risk management and value-based care capabilities, be able to forge those relationships in the enablement side to support these organizations on their value journey. And, having learning as such an important part of my background, it's been great to be with a company like this that is really, I think, building that bridge between learning and enablement and being what I see as one of the many important players in this value-based care movement.
Yeah, that's awesome. So speaking about coming down off the pandemic years, which is a wild time, some of the more recent news, huge players shutting down their virtual care networks. Telehealth seems to be really winding down, and utilization of telehealth even decreasing when, it felt during COVID that telehealth and the expansion of telehealth might be the answer to, health equity and access for rural areas and things like that. And then very recently, a couple of days ago, all the buzz about Walmart. I know you posted about it. Walmart just snapping their fingers and shutting down the entire Walmart Health. What do you make of this seeming, bend in the road that we seem to be coming around?
Well, I think now there's a collective recognition that, this is really hard work, Mendel, and we saw this with the Haven venture, with Amazon and JP Morgan Chase and Berkshire Hathaway, and now Walmart Health, and to a lesser degree, I think with Walgreens and Village MD, really trying to leverage brick and mortar within a retail setting, create and establish those relationships. I think the purity of the patient-provider relationship within a medical practice or a health system setting is really the epitome of where you can create models of care that can scale and demonstrate outcomes over time. So I just think we're seeing an evolution. But, to your earlier point, there is, I think, directionality around value-based care. I mean, if anything, the pandemic showed us that, financially, clinically, operationally, even spiritually, we have to align with the tenets of a value-based care model. We have to creatively redesign our workflows and adopt virtual solutions. I know telehealth seems like it hasn't quite gained traction, but I think that's where you're going to see this confluence between telehealth and remote patient monitoring and wearables merged with AI technology that we're seeing on the horizon. That's really going to create, I think, a tipping point where you're going to be able to span the brick and mortar of the traditional healthcare delivery system in a way that you couldn't before. I think this is an tremendous opportunity for value creation. I mean, we live in a really great time, even though there's certainly a lot of hardships. Health systems I know are dealing with a multitude of challenges, from the deterioration of their margin, workforce shortages, supply chain issues. I think at a macro level, we definitely have cost challenges and weaknesses in our public health infrastructure. But this is where I think a lot of the greatest minds in healthcare, which you and I have both had a pleasure of talking to over the years, are really thinking about how do we solve these critically important problems, that are going to have that lens of the moral and economic imperative within the business climate of healthcare to really think about realigning those incentives. So, I would not at all view, some of the the news that we've seen from Walmart Health as a bellwether of value-based care or primary care transformation not being something that can scale. I just think this is just another step along the path to where we're eventually going to coalesce on something that is going to be scalable over time. And, and certainly AI, I think, is going to bring us there in terms of being able to ameliorate a lot of the stressors that we have in the current environment by giving us a jumpstart opportunity by harnessing some of that improved clinical decision-making and business intelligence.
Yeah. What's interesting about you is that not only do you, have an incredible podcast history, and I personally know the value of speaking to so many incredible leaders. And so there's really a huge value there, but you've also been on the ground and really on the business side of value-based care. And so in your personal opinion, I mean, what are some of the details around you're obviously optimistic about it. It's interesting because I had another guest on earlier today who's quite critical and thinks that we've completely missed the mark, and value-based care is something that's not really come to pass. That's not going to pan out as something that's actually profitable. And so I'd love to hear from you actually having practical experience with running various value-based care initiatives, and speaking to multiple people that do like I do. What are your thoughts? Do you think it's going to be a winner? What do you think we're getting right? What do you think we're getting wrong in attempting value-based care?
Well, I think, if let me start with maybe a little bit of a negative spin. What are we doing wrong? I think not recognizing the imperative that we have to change, because there is such a inflow of funding that goes into the healthcare delivery system, upwards of $4 trillion, where, we just, it's easy to be comfortable. And I think that's where, as I look at the pandemic, maybe as an impetus for change. Think about how we view health equity now within the context of value-based care. We've had disparities of care among racial and ethnic lines, since going all the way back, hundreds of years to the transatlantic slave trade. And we still, through the design of payment models and value-based care, really weren't as intentional about making sure that we can re-engineer those models to create opportunities that serve all populations equally. And I think that's one of the positive things that came out of a negative, is that, now, we're recognizing social determinants of health and health equity is a huge opportunity. I also think with the Medicare Shared Savings Program, we've seen some positive momentum. There's still, I think, some malaise from some leaders that say, well, it's been around for 10 years, and is it even making, is it even saving at this point? The answer is yes, absolutely. Over the course of the program, it's saved, up over $4 billion as far as I know, and still growing. Now, I know that's a drop in the bucket, but I think you have to look at this as making a seismic shift in 20% of our economy. It takes time to fundamentally transform an economy of the size of healthcare, and I am optimistic about that, because I think there's this recognition that we do have to change. I mean, we can't continue to operate on a path where healthcare is the number one cause of bankruptcy in our country. We have all of these disparities and underserved and minoritized communities that we're not addressing, and just rampant growth. Yes, if you're the if you're the frog, boiling, in the hot, water, you can stay there and settle into something, but eventually you're going to die over the whole weight of the system. And I think that's where we are now. So I think there is some optimism that I have, just in terms of the recognition. And I think that goes back to my earlier point around the storytelling. We have to determine what the truth is of healthcare from a policy perspective. What is it that we're trying to accomplish? And, when I talk to the people like Liz Fowler, for example, who are, dedicating their career, her, on the federal side, but, so many others there with CMMI and CMMS or CMS. And then also industry leaders, these exemplars that you and I talk to every day, they're out there doing the work. And as I think about this through a storytelling lens, there's so many great things happening in terms of improving outcomes, creating enablement for providers to deliver care in a more interdisciplinary, relationship-based, holistic, tech-enabled way. That, this is a story that it can't be kept a secret. Like, you can be successful in a value-based model, but there's going to, like any change of this nature, there's going to be pain along the way. And I think we just have to have the leadership, not only from respective organizations, but also I think at a national level to guide us on the, throughout the, this course correction to make sure that we can do the right things.
Yeah. Well, I'd love to double click on the actual storytelling for a second. How important is it? You started the podcast. I guess let's go through your podcast journey. Why did you decide to start the podcast? And what is your advice to, there's healthcare executives are extremely busy, and some of them notably take time to talk on podcasts like ours and share their insights and share their stories. And many choose not to. And I have to imagine the ones that choose not to don't necessarily see it as a good use of their time. And the ones that do choose to see it that way. Yeah, I think I know where you and I fall on that on that question. But talk to me a little bit about your journey with starting the podcast and some of the power behind it, and some of your recommendations to other healthcare leaders around storytelling.
Well, I think like in anything in life, there's something that, I read it in a self-improvement book about the blue flame. And that's the part of the flame that's at the nexus of what you're good at doing and what you're most passionate about. The leadership, the inspiration, the storytelling, and just the connection that you can make with other leaders. That's something that I really wanted to be a part of in terms of amplifying the storytelling around value-based care. I'm a converted operator, so I've been, on the front line, working with provider groups, establishing networks, doing managed care contracting, setting up infrastructure, deploying programmatic interventions. But, whereas somebody like in the executive arena would just look to, what's the next step for me in terms of scaling this type of opportunity, getting into some type of next level, role within a large delivery organization, just in thinking about, my passion, for learning, I just thought podcasting made the most sense. Now, I think most everyone during the pandemic probably started a podcast, but it was this labor of love that I really think, allows people like you and I to thrive in this environment, because we're giving such honor to those that are doing that hard work in value transformation to tell their story. And this is we live in a busy time. I mean, not everyone does have the time to listen to the podcast, but I look at what you do in terms of your content strategy around YouTube, having short, more consumable bits of information that people could consume. But there's a lot of different ways you can go about having kind of a multifaceted content strategy that's going to resonate with particular leaders depending on how they consume intelligence. And that's kind of what I'm thinking about in terms of providing a purview of different educational offerings that align with the work that Lumeris is doing in value-based care enablement, to really be a part of that important transfer of knowledge that's ultimately, what I think in terms of my passion play is going to create a better healthcare system.
I love that. I'd love to understand a little bit more about Lumeris. What do they do?
Well, we're a value-based care enablement company, so we've been around 10 years, so longer than any other private enablement company. We're in 12 different states, manage about $13 billion in spend. We work with health systems, basically partnering with them, sharing and in risk across their Medicare Advantage, traditional Medicare, Medicaid, commercial populations. We have a proprietary technology stack that supports them on their journey in terms of delivering better patient experience, enhancing their quality metrics, executing on all the different things that you need to do in a multi-payer contract portfolio to succeed and fulfill that promise of value-based care. So yeah, we offer those solutions and enablement tools, and work with these organizations that are trying to position themselves for success in value-based care. And I think the types of organizations that we work with, and I would think most others that are in this kind of space, the profile of the company is, those that recognize that value-based care is the only way to be sustainable for the future. So there is a light bulb moment, I think, that happens in the C-suite and on the board level, where you're just thinking about, like, there's just no way we can continue to eke out a 1% margin every year when we're seeing such degradation in revenue and in so many all the challenges I mentioned before. So value-based care really does present a really unique opportunity, I think, to capitalize on something that I think over the course of time is really going to position providers for success in the long term.
Yeah. Yeah. One of the extreme challenges with any kind of technology like that is, and you mentioned the various payer contracts. Every payer has their own way of doing things. Something I was talking about earlier today, learning from somebody. It's really challenging for a system to be able to navigate. Every payer has their own workflows, their own way they want things done, their own way they want things reported, their own administrative workflows. What are some of those challenges that that these systems are experiencing that Lumeris is able to help out with?
Well, I think these health systems are extremely heterogeneous in their value-based care needs. There is a saying, you've seen one ACO, you've seen one ACO. There's the saying that healthcare is local, which basically says that, every organization is different. But there are some common foundational components to blazing a path towards success in value-based care. You have to have the technology enablement. You're going to need help with network aggregation and contracting. You're going to need to set up the right governance, have long-term organizational transformation that's based on leadership and instituting that right culture, and having the analytics and the AI, I think, to really drive important population health interventions and understand the needs of your patient population within these risk-based contracts. So I think it really starts with having the DNA of the leaders that recognize this moment in time where value-based care is a pathway to sustainability, them doing the work and turn that beyond the recognition to create the culture, and then getting creating a strategic plan where you have those successive tipping points where you can diversify your revenue portfolio and risk contracts, and then having an organization like Lumeris that does have enablement opportunities and solutionings that can support the kind of the idiosyncratic needs of those respective healthcare systems that are trying to succeed in these emerging models.
Yeah. So speaking about AI, obviously the buzz of the year. What's your roadmap look like? What do you think are what's the lowest hanging fruit? What are some things that you've actually seen in the market that can help health systems? And then what are maybe some next step things that we're hoping for in maybe the next couple of years?
It's a great question. Well, I think right now at this moment in time, what's really working with AI is the opportunity to aggregate large amounts of data, understand complex data sets, really have that surveillance that's needed to predict medical conditions and generate those insights out of population in a patient level. I think in the future, we're going to see opportunities to augment clinical intelligence. When you think about the future of AI, and I know you spoke with Robbie Pearl recently, but he when I was reading his new book, which, by the way, Mendel, I just bought your book today. I can't wait to read your book as well.
Well, thank you. Appreciate that.
Yeah, we share this passion for AI. But if you think about this moment in time, think about like Moore's law, where you have the number of transistors on a microchip. And since the early days of the semiconductor industry in the 1970s, like you would see the number double every 2 years. So if you think about, like hitting a milestone like 1 trillion transistors on a microchip, we hit 1% of that just a few years ago with an Intel chip that came out, and we're going to go from 1%, which was about 10 billion, to 1 trillion in the next 10 years. So just
Crazy.
the rate is exponential. And then you look at kind of the multitask language understanding of these models. You have like GPT-4, Palm 2 that are demonstrating remarkable performance on a human intelligence level. So, and you think about just how exponential the growth is for this. There is no foreseeable way to envision a future, not only in healthcare, but society at large, that doesn't have pervasive and ubiquitous AI support. I mean, like, if you look at moments in time, like going from an agrarian society to industrial revolution, or, from the horse and buggy to the steam train to the car, I mean, I think this is our moment. And if you look at some of the things in healthcare that we're trying to solve for, like access to care, clinical decision making, the provider shortage, how do we how do we deliver primary care when we have a shortage of providers? I think this is an opportunity to usher in a new era of healthcare, where we do create a kind of a virtualized interface for activating patient populations that can revolutionize healthcare delivery, but also get the outcomes that we're seeking in these value-based models that are going to improve outcomes and improve efficiency, provide opportunities for automation, reduce costs. I mean, it's a really exciting time to think about it. I mean, I know, we haven't yet, like right now, we're kind of in the fun, part of like seeing the early stage potential of it. We're still in the early onset of the commercialization of artificial intelligence. But I mean, when I talked to Robbie Pearl recently, he was saying, just like you have an iPhone in your pocket, and you see everyone else in society that has an iPhone or a smartphone, that's what AI is going to be for the future of healthcare. And I share in that excitement, that bullish, I think, recognition of the opportunity that maybe that is the missing link. If we can't disrupt our healthcare industry with kind of the entrenched economics, the fragmented delivery, the kind of the just the outgrowth of fee for service that we created, we can't undo that. Well, perhaps, like AI will be that catalyst to kind of create the pathways that we need to navigate some of this uncharted territory. So it's just a really fun time to think about, what that can mean in terms of, healthcare delivery in the future.
Yeah, I agree. I think our biggest inhibitors are going to be ourselves, and obviously, regulation, which I'm not saying there's no place for regulation, but there's also, a big possibility that it can tamp down the innovation. I think I saw this on the Rogan podcast a while back, but I think it was maybe even Elon was talking about the electric car and its ability. And he was basically saying, it was such an interesting point that he mentioned. He was basically saying that about a football field worth of people are killed every year by MVAs, right? By car accidents. And if all the cars went self-drive, I said electric before, I meant full self-drive. If all cars went full self-drive tomorrow, which they technically could, that would drop down. Let's assume, I don't remember the exact numbers. Let's assume that would drop down by 90%. Okay. So you just saved 90% of a football field's worth of people from getting killed, right? But the problem is, he was explaining, the problem is that last 10% of people that got killed by the full self-driving car having a glitch, and creating an accident, the problem is that us as a society, we can point to that thing and say, that thing, that bug, that software killed these people. And that's so much, we're simply not capable of wrapping our heads around that, even if it's going to, and the craziest thing is, he said, it would also, every bug that would, to horribly kill somebody, but that bug would be fixed and would go out across all the cars. And then all the cars would basically, it would evolve to basically next to zero. But we're simply, as a people, we're not ready to wrap our heads around that concept and say, that this is what did it. So I think in healthcare, that it probably carries over as well, where it's going to take a long time for, I don't know how long it's going to take for AI to be perfect. I don't know if AI will ever be perfect, because AI is trying to become, artificial intelligence, and the intelligence in the world is human intelligence, and humans are make mistakes all the time, So I'm curious how that will play out, but I suspect that'll be our biggest inhibitor from really taking that jump, is from a legal perspective, being comfortable and saying, we're gonna let this thing help in a really meaningful way,
Yeah, and I really think it comes down to having a definitive source of truth. I mean, if we are thinking about the power of the story, the story being the evolution of AI, the transformation of healthcare, if we collectively understand there is a promise of artificial intelligence, even the 90% of the people that you described in the Elon Musk example, they are experiencing the boom of proliferated intelligence, through these self-driving vehicles that has extended their life expectancy. But there is a cognitive shift that has to take place in terms of recognizing that, and I think we have to do a better job of telling the story of human beings. There's a Dale Carnegie quote about human beings being creatures of emotion more so than they are of logic, and I think that's where we have to somehow through platforms like this be able to communicate, share information, and then somehow create a mechanism where that can be pervasive throughout all of society, where we do align on the benefits or the potentially, I think, the downsides of technology. I think we missed our mark with social media. We didn't quite understand some of the drawbacks of what social media could have on relatability and cognitive development in young people early on, when we kind of scaled some of these social platforms. And I think now hopefully we can learn from some of that experience, and then create the narrative that's going to support, I think, adoption in a meaningful, purposeful, responsive way that can hopefully get the outcomes that we're seeking in terms of impact.
That's a very good point. It's worth thinking about. Wow. Well, Eric, we could probably talk for hours. But it's a thoughtful conversation. I really appreciate you coming on. I know people could definitely, you've got a fantastic podcast. I know people can definitely find you on LinkedIn. What are some other areas that people can find you?
Well, definitely go to lumeris.com, for insights. You can find Enabling Health Value, the podcast. Please reach out to me on LinkedIn if you wanted to make a connection there. And I'm always willing to talk to other trailblazers in healthcare. So I definitely welcome the opportunity, and so honored to be with you today, Mendel, to have the time to share a little bit about my story as well.
Well, thank you so much. It really was a pleasure.
Same here. Thank you so much.